2, 1.
Alright, so I'm gonna wash my hands. I'm gonna get the patient's ID. What's your name and date of birth?
Austin Dominguez, 129, 2000.
Okay, I'm gonna explain to the patient what I'm gonna do. So I'm gonna be taking a blood sample from you today. Do you have a preferred site? Assuming that they don't, so I would first tourniquet on. Oops. There we go. And then I'm going to palpate, find a vein. So I found my vein. I'm going to go ahead and release the tourniquet and put on gloves. So I'm going to clean the site with chlorhexidine. Alright, so I will let that dry for 30 minutes. Next I'm going to prepare my equipment. And I'm also going to check to make sure the label matches the patient's ID. It should have the name, the patient ID, the time and day, and also have my ID on it as well. All right. So I'm going to go ahead and tourniquet him back up. All right. So I'll put the needle double side up. Explain to the patient that he might feel some slight pain, a slight pinch, and then I'm going to insert it at a 15 to 30-degree angle. So 1, 2, 3. Alright, got the give. We'll go ahead and put this in. Fill with the blood. Fill it up to the recommended amount. Alright. I also should have released that, but so I'm going to remove this, set this aside, put a bandage over the site, and slowly move it out. I'm going to make sure to apply pressure for 2 to 3 minutes. I'm going to dispose of this in the sharps. And then, so again, yeah, 2 to 3 minutes applying pressure, and then I'm gonna put tape on it, which I didn't get my tape ready, but I'd put tape on it. And then, again, make sure that this is labeled correctly, and take off or remove my equipment over the patient to the right level, take my gloves off, perform hand hygiene, and then send this to the laboratory.